Okay, so how do you prepare for what we call an XLV treatment with the device? Mainly when we're doing this, we're probably treating your veins, but we could also be treating pigmented lesions. Really, the pre-care is the same, the post-care is pretty much the same. So what you want to do is that it's very important that you try to avoid any lotions or creams to the area, and you want that skin to be completely clean and dry. Because we want that laser to get to the level that we need it to go to actually eliminate a vein or a pigmented lesion. So that's the primary thing that you want to do ahead of time. If it is going to be on the face area and you are using a retinoid or a retinol or a glycolic or anything exfoliating that's irritating to the skin, or even a vitamin C, we do recommend you stop that a day or two before the treatment. And then during the treatment, it really feels like a warming effect. A little bit of a rubber band snap is what most of my patients describe it as. It's just that initial little moment as we're firing the laser, and then after that it's gone. So it's a pretty quick procedure. After the treatment, what you want to do, especially for vein treatments, is you want to use compression if possible. It's not required with laser, which is the benefit, but we highly recommend it because it does help quite a bit, especially if we're doing leg areas. You want to avoid any exercise for about 24 to 48 hours after treatment, and 72 hours if you're willing to. Sometimes we have to negotiate, but ideally 3 days would be the ideal timeline for you to avoid any kind of exercise. Other than that, you can go back to applying any kind of lotions and creams to the area after the treatment. Occasionally we recommend a little bit of ice if the area does look irritated, but otherwise it's pretty fast healing.